Welcome, everybody, to Her Body and Mind podcast. This is part 3 of a 3-part series on trauma. My name is Dr. Sierra Fox. This is Amanda Serch. We will be your hosts today. Now, in our first 2 parts, we talked about what is trauma. Then we talked about assessment. And today, in the 3rd part, we will be talking about how to treat trauma.
Which is the best
Yay.
one of the 3-part series, in my opinion.
Well, let's see about that. Now, why don't you start us off and let us know, how do you go about initiating treating PTSD and trauma?
Well, the 3 kind of basic ways that are supported in the research to treat trauma are top down, bottom up, which I will explain, and medication. So top down, meaning that it's going to be using more cortex, is going to be talk therapy, primarily cognitive behavioral therapy. Bottom up are going to be therapies like EMDR, sensory motor, biofeedback, internal family systems, and then medication. So when we start talking about how do we treat trauma, it's going to be one or a bit of a hybrid often of all 3 of those. They all have a place.
Yeah.
I would say that I use definitely top down and bottom up. And bottom up, just defining as trauma does live, as we talked about in what is trauma, trauma does live in a different part of your brain. And so it's more like old school language, which we don't really use anymore, would be like reptilian brain, like subcortical, lower brain. That is where trauma lives. And so you can't do talk therapy that is like more cognitive and expect to be treating it in the same way as like a bottom up.
Would you like use like the subconscious as an analogy for like that more primitive, because it's people aren't aware of it in a way?
Yeah, I think you could, like the idea that a lot of symptoms are subconscious and that people don't realize why they're reacting the way they're reacting to it. Like trauma, by definition is a hijacking back to something that isn't happening anymore.
Yeah.
And so that is for like often happening subconsciously, unless you have like more serious PTSD and then it's very conscious and you're having flashbacks. So
Got you.
yes and no.
Okay. Very good. Now, once you've chosen an approach, which it sounds like you have chosen your approach, which was, I'm going to get them mixed up.
It's okay.
Bottom up, or what is your?
Yeah, I think that if you're doing trauma therapy and you're doing it well, you should, if in my opinion, should definitely be doing more of that like bottom up type therapy.
Right.
But I start with talk therapy. I start with cognitive behavioral therapy, and then move into the deeper trauma processing because they require safety, which we'll talk about in a minute.
Okay. Now, with that, what do you do once you're using the approach then? Like, how do you use that particular approach, which was bottom down or bottom up?
Yeah.
Bottom up. Yeah. Bottom up.
And that's like, it's like weird language, right? I think first, before we're getting into what I do, I think it's looking at like the phases of trauma treatment. So there's kind of 3 distinct phases of trauma therapy. And I think sometimes these aren't used correctly and it can cause like a lot of harm. And so I practice in this way. I mean, there's lots of ways to do it, but the phases I kind of subscribe to in my office. So first is like assessment, which we just talked about. So we have to assess like, what are your symptoms? Why are you here? What are we going to do?
So that's phase 1?
Well, that's part of phase 1.
Okay.
And then phase 1, just like broadly, is called like safety and stabilization, because we need people to be stable enough and feel safe enough with their like own bodies and nervous systems and their behaviors in order to go into the trauma.
Makes sense.
So safety and stabilization is a lot of that. Talk therapy, cognitive behavioral therapy, symptom management. Like if someone's got like a really bad anger issue with PTSD and they're yelling at their family and their kids and all of those things, we need to kind of help them regulate that a little bit. If there's risk here, someone's suicidal, we need to make sure that they're stable enough to do this therapy. Or if they're just incredibly dysregulated, like PTSD does, we need to stabilize them first. So safety and stabilization, and that sometimes is referral. Like that's where I'd be like, you should go see your naturopath or your family doctor and talk about sometimes here medication or supplements or other things because you're not coping at all. And I don't think, and they don't think that they're going to be able to handle phase 2, which is coming to terms with the traumatic memories.
Right.
So phase 1, safety and stabilization. Phase 2, coming to terms with the traumatic memories, which is where we would use like some of these bottom up, which is like EMDR. We'll talk about different ones in a minute. And then phase 3, which is actually quite complex, but doesn't sound like it is moving forward. So people are like, oh yeah, I can't wait to get to phase 3. But once you've stabilized your nervous system, processed your trauma, especially if it's complex, often your whole life looks different. So sometimes relationships don't fit. It's this like existential question of like who I am now, like who am I now? And how do I want to live my life? And is my job working? And are my friends working? Is my relationship working? And so kind of moving on once you've processed, especially with big T, like complicated trauma is actually a huge part of therapy.
Yeah.
So those 3 phases are all part of treatment of trauma.
Yeah.
Yeah.
Now, next question being, talking about risk, you brought that up about the first phase. And I know like, cause I'm aware of this in my office, I have to be very careful about what I ask and how much I ask while still being able to get the information I need to assess, like, do I need to make a referral?
Yeah.
But I also know that I've heard many stories where they aren't set up properly in phase 1 and then stuff doesn't go well in phase 2. It's just not, it's like more traumatizing than anything.
Yeah, absolutely. Even the like whole idea of, do we take a thorough history from someone on the first session? Like there's a lot of different opinions on that.
Yeah.
I like to not take a deep history for a bit because especially with complex trauma, a lot of people have never said these things out loud. And so getting them to go through everything bad that happened to them in a 15-minute period makes them have like just like a terrible week and sometimes can put them at risk for self-harm, suicide, all of those things. So when we're talking about safety, it's about being able to quite quickly assess where someone's at when they're sitting in front of you, what resources they have, how stable they are, because people often come in and they've been waiting for like 6 months to see me and they want to tell me everything. And I have to be like, hold on. Like,
one thing at a time. You have to strategically go about it. You can't just like, unleash everything and open it all up, so to speak.
Because there are risks. And even when you're in the thick of it, being able to structure sessions appropriately where we're digging into this like big, terrible thing, but then having enough time to like wrap it back up and send them out into the world without just like leaving your office, which sometimes you can't fully control, which is just reality. But that's a huge part of safety of this because trauma therapy, if done incorrectly, can definitely cause more harm.
Yeah.
Which is where therapists need to have the right training and know what they're doing before we're dipping into especially like sexual abuse, childhood stuff, because it is really tricky once you get in there.
Yeah. You mentioned like the packaging it back up and sometimes things explode at the end of your sessions. You mentioned this before.
It happens a lot.
So that's more the risks with the sessions. Now, you mentioned a few different modalities with the different processes or options.
Yep.
So you mentioned from your approach, which is EMDR, IFS, is kind of what you primarily use. What is EMDR for people that don't know?
Well, EMDR is amazing. EMDR is such a wonderful therapy because it sets people's nervous systems free from trauma, and it is incredibly effective when done correctly.
Yeah.
So EMDR stands for eye movement desensitization and reprocessing therapy. So essentially it's bilateral stimulation of your left and right hemisphere. You can be holding buzzies. The original is eye movement. So following your therapist's hand back and forth, there's light bars, tapping, bilateral stimulation of your left and right hemisphere while engaging in working memory taxation. allows us to process those memories. So when we talked about in the first session, what is trauma? We talked about how traumatic memories don't get time-stamped properly. They don't get integrated into your hippocampus, and they're just kind of like stuck there, which is what causes this like hijacking back all the time. So this thing's happening, but you're feeling really dysregulated because your body's responding to this thing when you were 8.
Yeah.
So EMDR allows us to have people integrate these trauma memories and make the memory historical, which then massively decreases symptoms. So that's EMDR in like the quickest nutshell. And that's what we would do in phase 2, where we're creating really good target sequencing plans and figuring out, because the biggest thing here, we're treating symptoms, not trauma. And that kind of gets muddled in here too when we're talking about treatment, is that someone can be like, this thing happened to me. I'm like, okay, what's the symptoms? Because not all exposure to trauma is going to lead to trauma symptoms. So we need to treat symptoms, not trauma. But we'll be doing with EMDR, like a target sequencing plan around the symptoms, and like people's lives change from this. It's just amazing when done properly. Because a lot of people will be like, oh, I did EMDR. And then when they break it down, I'm like, you did not. So yeah, when done right, EMDR is the best.
Yep.
I'm biased.
And like, just kind of wrap that up. It's just cross-talk between the two. When you say hemispheres, it's like two sides of the brain. Two hemispheres is getting both sides of your brain to communicate with each other. That's essentially what that bilateral stimulation is doing.
Yeah. And like, we're in the infancy of understanding how the brain works. So we have really good like functional brain imaging to show that pre-EMDR, we see like fMRIs showing typical PTSD activation. After EMDR, we don't. Why? Doing bilateral stimulation, and in more like in the last 10 years, it's a lot to do with working memory taxation. You know, the jury's a bit out on this, but why doing this bilateral allows us to heal trauma, like, but we know it works. Just like we don't really understand the mechanisms fully on like why some meds work, but they're like, oh, this is efficient. So, and EMDR is also really risky if not done right.
Yep.
Because you're opening up trauma. Because what happens in EMDR, which is quite amazing, is that your brain will just sort of like open up this file cabinet of the traumatic memories. But say you're in a car accident, and so you're just trying to process this, but then you felt powerless, but you also felt powerless at this terrible thing at age 4. This will open, and then this is open, and there's all these doors open. And so it can be done safely and can be done. There's so many different protocols for EMDR, for first responders and all kinds of things, but it is really, really, really effective.
Totally.
Yeah.
Now, where does IFS fit into this? Because that's the other one that you mentioned you like to use.
Another beautiful therapy.
Yeah.
So IFS is internal family systems, and this one was created by Richard Schwartz. You know, if we look at the research, we see EMDR very, very high up there, and IFS is very well supported as well.
Yep.
So IFS is based on parts. So in IFS, we have this idea that we have like a self. So that would be the versions of us that are, you know, unburdened by the like terribleness of the world.
Yes. So
we experience a trauma, and then in this theory, parts of us get developed to try to make sure essentially that we don't feel that again. So the parts of us that are injured, they would call them the exiles. And then we develop different parts to make sure we're not hurt again. So if I was treated really badly and neglected in my childhood, I might develop a really avoidant part that doesn't let anybody get close to me.
Yep.
And IFS is a really cool trauma therapy because unlike EMDR, once you learn the structure of IFS, the kind of motto of IFS is self-led leadership. So you can start kind of building a relationship with this internal world from self, and you can do that on your own.
Yeah.
And so it's a really good, although IFS and EMDR don't really like each other. Everyone's theory is the best theory, right? Yeah. But I find that when people come in and they're like, EMDR didn't work, it's because they have a manager protector part that like ain't letting no
Shutting her
therapist
down.
getting in there.
Yeah.
So until you kind of can work, and sometimes we can just do EMDR, but sometimes we have to do IFS first and kind of build that relationship and have those parts see that like, this is safe. We're a resource.
okay.
We can handle this. And then those parts will step back and let us do the trauma therapy. But you can do pure IFS, and you can, and the research supports this, do a lot of healing with just IFS. But I love EMDR.
Okay, so it's very clear you play favorites.
I do. Just with
IFS,
the most effective ones.
Yeah, IFS and EMDR. So tell me why you favor those compared to CBT, talk therapy. Like, obviously there's research. You're not just like playing favorites, but
No,
yeah.
it's because they're effective. So we do know in the research, and again, pure CBT people will disagree with me here, but CBT is not effective at really treating trauma. And I see this, you see this, people have been in therapy for like, I don't know, 9 years. And talk therapy is effective here to like build a narrative and like, this happened to you and this wasn't okay.
It
and
creates understanding of what you
Yeah.
went through and like helps you with coping strategies.
Yeah, which is needed and helpful and not useless.
Phase 1.
Phase 1. But we need phase 2. And so people get stuck in that talk therapy, and you're not going to get rid of those massive dysregulation, I don't believe, and I've never seen with that. So that's why I favor those two. And there are others, like sensory motor is a really good research back trauma therapy.
Mm-hmm.
I think we just can't, EMDR is so complex that you can't do it all. And so I've done training in all. EMDR I just found fit better for me. I think I started as most therapists do. I do really find benefit in the cognitive space, and EMDR does lend itself a bit because it's a lot on switching belief systems, which is a lot of the foundation of cognitive behavioral therapy. So there are some overlap there. Sensory motor is a really good one. Biofeedback has a lot of good research to support it. And then if we're talking about just treatment types, more recently, like the psychedelic world is a whole thing on its own too. And so the idea of that is taking like medicines, whether that be psilocybin
Ketamine.
or others, that's essentially helping you get past all those manager protector parts and really diving in. And then what we're seeing in the research is that the brain is like engaging in neuroplasticity a lot faster.
And it has to do with the crosstalk too.
Yeah.
It does. So
with this, like
the integration.
Mm-hmm.
Yeah.
So that, it's integrating trauma. So you have to get to the memories, and then we're seeing change really quickly, but there's lots of risks to that as well. Pros and cons. We'll do a whole episode on that one.
Yeah.
But more and more research is really supporting that as well.
Yeah.
Yeah.
Okay. Well, that's cool. Now, common theme in my office and everybody's office is that there's a lot of acceptance around like, this is just my life now.
Mm-hmm.
Like people just feel like they actually know they've experienced trauma. They have PTSD. They're traumatized, and they're just like, this is just who I am now. This is just how it is. Why is that?
I think because there's a lot of not good treatment. Like again, counseling as a profession isn't regulated. So there's a lot of people saying they're doing trauma therapy and they're not. There's a lot of people with really complex trauma that have tried to do therapy, and they've either found it way more harmful because they just talk about the terrible thing and then they go home, but they're not doing the right therapy. So they're finding no relief.
Yeah.
Or they just do talk therapy and never really get into it. And that just feels like a hopeless like endeavor that's expensive and really, really, really activating. Therapy's hard work, right?
Yeah, I would have to agree. That's what I see too.
Yeah.
Yeah.
And I think sometimes we really just accept what we know and we find ways to treat it, whether that's with like drugs and alcohol or other maladaptive coping strategies. And it just feels like it's the devil we know. And it's so freaking hard to come to terms with your traumatic memories. And I think that that's like the purpose of even talking about this is like, it is treatable.
Yeah.
But it is like, I never cease to be amazed by the people sitting in front of me doing the work they're doing, because the courage it takes to do that is like, it's amazing, honestly.
I think that's a like the top two barriers would be, like just believing that you treated it when you in fact have not. You haven't done the proper EMDR, you haven't done it at all. And then kind of what you just said as well. So people, I just lost my thought.
They don't, they just, it's like what they know, or it's just really hard to get in there.
I think, that's what I was going to say, is that it's overwhelming, the idea of processing. Like they're just like, I can't go back there. Like I've tried and I'm not going to do that again, because they've gotten worse in a session and have dealt with the consequence of that.
Well, in our last episode assessment, we talked about what is a cornerstone kind of diagnostic criteria of trauma, which is avoidance. And so asking someone to come and look at their traumatic memories goes against one of the biggest symptoms, which is to like, you learn to avoid that part of you. You've learned to just like completely cut off from your body.
Yeah.
And so like the biggest thing that I say a lot is like, trauma is so treatable. You still can get triggered sometimes, 100%, especially with big T trauma, but not in the same way. Not when those memories are integrated. It's so different.
Yeah, that was a question actually I thought of earlier. Is there any level of normalcy to feeling slightly unwell after session? Like, what's the line there where you're like, you're re-traumatized someone, or like, should you just feel fabulous, or what should you actually expect after EMDR session? Because I think that that's maybe confusing too.
So after a session, we talk a lot about like the risks of doing the therapy. So after session, especially for 72 hours, people do have some side effects. So like, sometimes nightmares are worse. They can feel anxious. They're really tired, but that's why we've done really good phase 1, and that they can handle that by the time we're doing that EMDR.
And they're aware, they're informed that might happen.
And what I always say to people, although those symptoms scare people, especially because EMDR can in between session get people can not do great. It's rare, but it happens. It's still better than living with trauma. Like living with trauma is the worst. And then after, in terms of like how much people can heal, is going to be varied to each individual based on like a number of factors. But I've had like more people than I can count come in with like a whole bunch of symptoms, thinking they had bipolar or this or that. And we clear their trauma and they're sleeping through the night, no more nightmares, or showing up in relationships differently, feel like they're valuable, and they're getting different jobs, and they just like feel calm for the first time in their body, which is very weird for people when they're like, wait, what is this? It can completely change your life.
Totally.
So
amazing.
It is amazing.
It's amazing.
It is. Love trauma therapy. So yeah, there's lots of ways to treat trauma, but it's just making sure that you're working with a practitioner that understands what trauma is and what it isn't. That's a big piece.
Yeah. Very good.
Yeah. So you see this a lot. What are some of the ways, like if we're talking about like phase 1, which is safety and stabilization, because especially with PTSD, I am referring often back to a GP or naturopath, because like pharmaceuticals have a place here, especially with PTSD. The research on trauma, meds have done really good things in the trauma world. They've also done really bad things, as meds do. But they have a place. I need to plug that, because some people are like, I don't want meds. But then I'm like, but you need to be stable enough to do the therapy.
Yeah, you have to break the cycle somewhere. That's what I tell people.
You gotta break it.
Yeah. So in my office, for sure, depending on how complex the case is, because some people really do need to see a psychiatrist, because it's not just going to be one medication. There's a lot of different factors feeding into it. But yeah, I definitely use medications in my practice, like SSRIs, to help with mood stabilization. And then, I mean, as naturopathic doctors, we have to look at the whole picture. There's so many pieces. Like, we're working on their diet, we're working on sleep. Movement is a huge thing that we talk about, obviously. And this is without taking anything. This is just like talking about basic stuff. And then as far as like, well, if we're using a modality, whether it be a herb or acupuncture or nutraceutical, it really is about regulating the nervous system and having cortisol come down, because in PTSD, trauma, et cetera, there's a lot of dysregulation. It could be high or it can be completely flat. Either way, you're going to be symptomatic, but it's really just giving you more balance, so you're not up and then down and then up and then down. So those tools, the modalities that I noted, can help with just even things out while also looking at other factors through like lab work. Like you do have to look at the thyroid, you do have to look at iron, you do have to look at B12, all these different factors. Like those things are off. It's going to make anything in your life exponentially more difficult to cope with because you're just not optimal. So you need to like optimize the body as a whole in the processing. But sometimes people can't do any of those things, diet, lifestyle, etc., if they're stuck in this cycle. So you do have to find a point. Sometimes the only thing that will work is a medication. Sometimes a nutraceutical or a herb will do it, which is fantastic too, or even acupuncture. But it depends on how badly or how the severity of the case and what it's doing to their day-to-day living. So if someone can't go to work and they can't sleep and you know, they're not functioning, then we have to find something that's more immediate that's going to help relatively quickly and stabilize them so they can do the things to help balance. So a lot of people, when they come to me, they're like, well, you're a naturopathic doctor. Like, I don't want to take a medication. I didn't come to you to get a medication. So a lot of people don't know that we can prescribe medications, but sometimes that is the way. And I'm not convincing people to do it, but I'm presenting both sides to the argument, saying, well, this is the scenario here, this is the scenario here. Like, here's why we might need to use this temporarily just to get you into Amanda's office to do the therapy so you can start processing. So then we can bring you down and just start using other more conservative strategies that are more natural. So,
well, and trauma survivors are really good at surviving. They're really good at white knuckling it through everything. Cause that's how, especially with like a lifetime of trauma, it's how they've had to live their whole life. And so they're really good. They're like, no, I can handle it. I'm like, but it maybe doesn't have to be that hard. Like there are ways where we can do this, where you can feel a lot more stable, because doing the deep trauma work, especially for like complex trauma, is really hard. So just because you can do it without meds and you can fight through it and deal with those like nightmares, and like you maybe don't have to. So that's also a piece of it. Just because you can doesn't mean you should.
Yeah. And a lot of people try it one way and then we learn that it doesn't work and then we go back the other way. Like I don't tell people what to do. I present different options. What they're comfortable with, we do. But at the end of the day, like if something's not working, you do have to try something else. And sometimes it is medication. And sometimes it's stepping out of talk therapy and entering into other types of therapy too. It's like figuring out what's working and what's not. For that particular person, there's no cookie cutter here. Everyone's different.
So the biggest takeaway here is that trauma is treatable, and that is a wonderful fact.
Yes, it is.
Well, that's it, I think.
It's a nice note to close on.
Yes.
You can be healed. All right. Well, that wraps up our three-part series on trauma.
Yeah. We'll talk more in other episodes about different, like we didn't talk much about dissociation. There's so much more we can do, but I think it's a good overview of what it is. How do we assess it and how do we treat it?
Yeah, very good. All right. Well, stay tuned. Next week, we're going to be talking about ADHD and I'm going to be the case study. So exciting. Women not getting diagnosed until their 40s and what that looks like.
Stay tuned. This podcast is for informational purposes only and does not constitute medical or mental health advice. We're not your doctor or your counselor. Please contact your own healthcare providers before you make any changes to your health and wellness protocols related to your body and mind.